So knowing what to do and how to do it is one thing, but actually doing it on a daily basis, sometimes several times a day, is another thing. And it won't always go well every single time. Sometimes it won't go perfectly ever. But there are some things that can be done to help you have more confidence in what you're doing to try to help somebody get to and from the bathroom. So we're going to talk more when we do the practical demonstration on how to help somebody transfer, but we're just going to run through some of the key principles. And it doesn't just apply to going to the bathroom, it would apply to going up and down stairs or getting from the living room to the kitchen. So we're going to talk about 5 different types of transfers. The supervising, just talking to them, or what we call verbal cues. And oftentimes, preferably, that's all that's needed. You just guide them and talk to them and encourage them in the right direction without actually having to touch them or to physically lift them. Number 2 is helping somebody to get out of bed, because that's one of the major challenges. I said that getting up from a chair is one of the defining moments for somebody who's able to stay at home versus someone who isn't. But some people spend too much time in bed, and so they get to feel like laying flat is actually a normal position. So when you go to sit them up, they're actually disoriented and feel like they're falling forward. So it's important to try to help people stay upright in bed. So sometimes a hospital bed that you can raise the head of the bed up is something you would start with. Just raise the head of the bed up so that they get the feeling of being upright and looking forward. But getting somebody to be able to be independent, rolling from their back onto their side up into sitting, is something we need to preserve for as long as possible. And then we're going to talk about something called the standing pivot transfer, which is where you're helping them to move from point A to point B. The thing that we get asked most by caregivers is, well, that's all well and good, but what do I do when they've had a fall? Because that's the most distressing thing. They may be injured or just simply embarrassed, and you're panicked wanting to get them up. And so knowing how to do that as safely as possible is important. And how to help them get up or have them help themselves get up. Both are important. And I want to take the opportunity to mention that here in Nova Scotia, if someone has a fall, you can call 911 and the ambulance drivers will come to your place of residence, and they will help get the person who's fallen up. And if they don't take them to the hospital, there is no charge for that. And so I just want people to know that, because sometimes it happens in the middle of the night and you're not sure what to do. So using the right transfer is important, because if you don't, then it can create back or neck issues, and we want everyone to be safe. So again, we started talking about just supervising and just talking the person through using short, simple instructions, and we'll demonstrate that next. Helping somebody get up to the side of the bed is one of the most challenging things. This picture shows somebody who has weakness on the left side, and so we're going to be getting them up onto the right side of the bed. So in this position, you're going to have the person try to bend up one of their knees, which would be the left knee in this case, so that they can do some of the pushing. The more the person does themselves, the less risk to everyone. So in this case, in picture number 3, the person is going to roll onto their side, which can be difficult if they have shoulder pain or neck pain or weakness, and you're just guiding them to roll onto their side. Part of the reason for that knee being bent up is so that the caregiver can put their right hand on that left knee and just gently give it a little pull to guide them where they're going, give them a sense of which direction they're going, and you can also use a little bit of leverage to help them roll. The hand position of the caregiver on the left hand to the person's left shoulder is meant to support the arm, not to pull on it. It's really important that we don't pull on people's shoulders, because then we end up with torn rotator cuffs, and we don't want that. In picture number 4, when the legs are dropped over the side of the bed, that's actually an opportunity for leverage again to help pull the person up into sitting. So we don't want to do this really, really slowly. If we can, we want it to be a smooth movement so that we're using gravity as the legs go down to help pull the top part of the body up so that the caregiver may not even have to help at all other than to ensure that they don't slide off of the bed. So in picture number 5, the caregiver's not necessarily pushing or pulling them up. They're just having a hand there to reassure them and to make sure that they're not going to slide off the bed. And you'll notice the caregiver's got their feet wide apart because that protects their back and makes them more stable. The end goal is to just get the person up to sitting on the side of the bed and let them sit there, let their blood pressure settle, any motion sickness or dizziness that they experience, let it settle unless there's an urgency to go, and you just let them sit. And then you may say to them, "Are you ready to go?" If you physically have to help the person get up, that's when the actual correct principles become really, really important. So this is called a standing pivot transfer, and all that means is that you're going to get the person up into standing, and then you're going to pivot them to a different position. And if they're going to be walking, then you're simply standing them up until they can get hold of their walking aid. If this is someone who cannot walk, then you're going to be transferring them into a wheelchair. So whichever one you're doing, you want to make sure that the equipment that you're using is right beside you in the right position, because if they need your help, all of your attention has to be on them, looking them in the eyes, not at where the equipment is. You need to know where that is. If it's a walker with wheels, you need to have the brakes already on. If it's a wheelchair, you also need to have the brakes on and the foot plates moved out of the way so that there's no barrier to getting them safely. So in this case, you're going to talk to the person, you're going to be as close as possible, and in some cases that's difficult because you might not know the person very well, or they might not know you or remember who you are, and so you're getting into their space and you need to do that carefully. You're going to support them, preferably with a safety belt, but if you don't have one, then you want your hands below their shoulder blades or on their middle back so that you're not pulling on their shoulders. And then you're going to use the correct procedure in terms of standing them up. You're going to have their feet apart, your feet apart. You're going to count 1, 2, 3 up, and you're going to guide them step by step. And we'll show that when we do the practical video. If someone is by themselves, which is the most common thing that we see, they need to know how to get up from a floor, and having them practice this teaches them what they should do. So in this case, if they're nowhere near a chair, it's going to be almost impossible to get them up. So having chairs placed throughout your living accommodations can be important. And you want it to be a heavy, sturdy chair, not something that's going to tip over if they pull. So in this picture, it shows the person trying to move onto their side, up onto their hands and knees, approaching a chair, bringing one knee up, holding onto the chair, and then trying to push themselves up using their legs and their hands up into sitting. If someone has fallen and hurting themselves, and they may have broken something or hit their head or they've been unconscious, this may not be the first thing that you're going to do. They may need to call 911, have the person evaluated. You're not going to instinctively just have somebody get up, but if they're by themselves, this is the strategy that we want people to know how to do. If they're in pain, they may not be able to do this. They may not remember how to do this, and they may also not know what to do once they've gotten up. So having a phone in every room or having a cell phone in their pocket that if they know how to use it can sometimes be a very good thing. And this is a good time to mention that there are call buttons that people can wear either on their wrist or around their neck. Sometimes they don't remember to push it, but there are fall sensors associated with these two devices that now will automatically call whichever company that you have hired or engaged to monitor them. So if they have a fall, it will automatically call a caregiver that you've designated. Number 5 is if you are there, you've witnessed them fall or you've heard them fall and you're going to help them, there are steps that we're going to go through and show you in the video. But the first thing is always just make them comfortable. Don't necessarily get them up. Occasionally people have broken a hip or a pelvis or a wrist, and you don't want to pop them up in a rush to help them overcome the embarrassment that they might feel. Oftentimes, if they've had a fall outside the home, that's the instinct, get them up right quick. But you want to make sure that they're safe, that they're able to communicate with you, and that you've either asked them or checked them out by maybe touching the various parts of their body to see if anything causes them to flinch. If they don't seem to have any major injury and you have a safety belt, then this is the time that you would put it on, and you would try to have them onto their side. You would bring the chair over to them, and then you would have them again try to get up onto their hands and knees, or you may in fact have to lift them into that position. Then you help guide them through the regular strategy of bringing one knee forward while they hold on to a chair or a couch if it's closer. And then they hold on to one chair and you have another chair behind them that they're going to sit in, and then you let them sit, and then you do a further inspection to see how they're doing. If these are all too difficult, then again, that's when you call 911 and they would come and help you.